Welcome back to Latino Motion. Family members that are caring for loved ones who are facing end of life can benefit from services that are available to them. Joining me are Sandra Gomez and Reverend Robert Velasquez from Angelic Help to tell us more about these services. And, you know, it's not just about those services, it's knowing what services are available to them. We'll get into that. But what is hospice?
Hospice is end-of-life care. It is a service that's set up for people that have life-limiting illness and the prognosis is 6 months or less. So we provide a team, which includes a nurse, the medical director, myself, who I'm a spiritual care provider, social worker, home health aide, and an RN.
Obviously, families are struggling through this process all along the way. They need that support and help.
Absolutely.
How much of a barrier is it for the Latino community to seek that kind of help?
Well, in this moment, we have professionals speaking Spanish in the office, so they can call.
We have bilingual staff that provides care, and that not only provides care to the patient, but also provides care for the family, gives them the support that they need.
So who qualifies for the services and what are the services?
The qualifications is that a doctor has referred this patient stating that their prognosis is 6 months or less if the disease takes its normal course. There are all types of illnesses, not just cancer, that fall under that criteria. People can have lung disease, they can have renal disease with their kidneys, they can have cardiac illness, all types of disease where the prognosis is 6 months or less. What is it that we provide? We work as a team. We work as a team to provide care for the whole family. With the patient, we provide medication, we provide durable medical equipment, and things of that nature.
Sandra, you guys actually go into the home to provide those services?
Wherever they call home, a facility, a nursing home, wherever they live with the family, doesn't matter who live with them, doesn't matter the situation of the family. So we always go to where they live and care them on the same
And of
space.
course, you have families who are stressed out. They need a break.
Yeah.
So do you provide that sort of break
Yes.
for them and caring for them?
It's exactly what we do. So we help the family to go through the hard time, being a loved one so sick and is helpless. Nothing can be done, just wait. And nobody knows when it's going to happen.
We provide care in the sense that there's a home health aide that usually comes 2 hours a day, Monday through Friday, sometimes on the weekends. And also a family or a patient and the family is eligible for respite care, which means that if a family member is overwhelmed with providing personal care, that patient is eligible to go for 5 days to a facility where they can be cared for, the family member can get the rest that they need, and they can resume again after that 5 days.
Now, as a reverend, I know you know the answer for this. How important is the spiritual aspect of this?
Absolutely. People need hope. People need hope, and that's part of what we do. We do it holistically. Each discipline provides hope in that they give the patient and the family the help that they need, whether it's psychosocial, whether it's care for the patient, whether it's medication needs that the nurse handles. But there's another important aspect, and that is volunteers. Volunteers are very, very important because oftentimes there's a sense of isolation that a patient feels and that their family member feels. A volunteer helps to fill some of that time. And so we need Latino volunteers.
Who pays?
Hospice care is paid by Medicaid, Medicare, and private insurances.
And we know, Sandra, you know very well too that we do have a large undocumented community. Do you turn away people who don't have insurance?
No, we don't turn away nobody. We always work it out to help those people. We had a couple patients on there let's say, charity. So we take care of them. We never turn down nobody.
No, that's important to know, particularly for within our community. Tell me, what are some of the success stories that you hear in terms of how you make the family feel?
Some of the success stories deals with a person who is dying, feeling that their family is also being taken care of during this difficult time. They're concerned that his wife or her husband or her children have someone that can provide support for them as they themselves, the patient, is going through the final stages of their life.
So obviously, you do have a phone number and a web page. I'm going to put that up on the screen. But let me ask you, how important is it for those folks who are not taking advantage of those services to take advantage of those services?
It is very important because the kind of comfort and the kind of services that they're going to need at this final stage of their life and helping their family is very, very important.
And it's better to have it when it's available and as soon as possible, because you worry for your loved one to get better or get stable, but you don't really know how to do it. Right. So let us take care of it so we can help you.
There's a helping hand that could help.
We can.
Thank you so much. That's all the time we have.
Thank
you for joining us at home once again here on Latino Motion.